I've found that my career has started out on a more technical level. I always cared deeply about the patients, but I was so busy that I was more focused on diagnosis, treatment, and not as much on long-term care of the whole patient. So as I've gotten older and looked at the patient safety issue from the side of communication and empathy and compassion, since I've done that, I find that that's more about caring for the whole person. Electronic medical records means that all the patient information is on the computer, and so all the doctors who have access to the web can, and all of them do, can access the patient's information. There wouldn't be a situation where a person's unconscious and if you know their name and their date of birth, that you wouldn't be able to find out what medications they're on, what medical problems they have, what procedures they've had in the past. That's going to be helpful for information purposes. It will make a safer environment for patients. When a patient comes to the doctor's office for a visit, they want to bring their list of questions. What issues do they want to discuss? On my questionnaire, patient history questionnaire, the last question is, what do you want to discuss today? Is there anything else you want to discuss today? I think that's important to ask the person at the end of the visit. So if they have a list, they'll be prepared, and they won't go home and then say, oh, I forgot to ask the doctor this or that. It's good to have a list of your medications, supplements, vitamins, anything you're taking, anything unusual in the diet. It's good for patients who've had surgery to remember what type of surgery they had and what was the outcome. So I encourage patients to get a copy of their operative report, at least a pathology report if some organ was removed, and hospitalizations. So they need to know something about their history. A girl can see a gynecologist at any age. Adolescent girls can come and see the gynecologist just for discussion, just for education. They don't have to have an exam. A woman can see the gynecologist without having an exam of any intrusive type of exam anytime. The guidelines are that sexually active girls should have an exam to screen for sexually transmitted diseases, to be educated about sexually transmitted diseases, to be provided with birth control options, and there should be a discussion of birth control, emergency contraception, etc. These discussions could go on even before they become sexually active. But the exam, the pelvic exam, the speculum exam, can be done at any time that a person is sexually active. The first pap smear is not done until at least age 21 currently. I would hope to be familiar with the ways to speak about the transition and, what terms are comfortable and what terms are uncomfortable. There may be certain terms that I might use that I would not, that might be offensive to the transgender person. I would just be candid with the patient and say, this is new to me, and please correct me if I say something that is not that you're not comfortable with. Then there's certain basic medicine that I've learned about hormones and their effects on different organs. And there's basic screening tests that a person needs for the organs that they have. So I would just need to find out from the patient what organs are intact and have a complete list of the medications, the hormones that they've been taking, and just like anybody else. The letter of introduction might help, or faxing a note, or if you've got a secretary on the phone who is personable and respectful to people who call on the phone, they would take a message and say, I have a patient who has a special issue, would like to talk to you very briefly before the visit, and that doctor would call back. If the doctor doesn't call back, then they may not be the right doctor to go and see. But I think it's important to make contact with the doctor first and let them know why you're coming, and then go ahead and access care from that provider. So you don't have, but there really is a pressure in terms of time to get the patient in, get the patient out, get to the next patient. How connecting with the patient is important in helping them to manage their problem, and in the doctor giving the best care. A good example of this is where the patient is in a very emotionally stressful situation. For example, the patient I can recall having her water break at a very premature stage of her pregnancy. Hearing from one specialist what the consequences were for her, and her husband hearing the consequences, and then because they were fearful for the outcome of their pregnancy and for the health of the mother, it upset them. And I met them. They were angry because of fear of losing their pregnancy. And they felt that the doctor had made them give up hope, or had taken away their hope. In listening to them, and I realized when I heard their certain anger level was coming out, I just asked them to repeat what had happened so far. And then in listening to them, I realized what the problem was, that the fear and the loss of hope turned into anger. In basically repeating some of what the other doctor had said, in terms that they seemed to feel more comfortable with. They were more at ease. They felt cared for. And they were able to listen to the whole team, and not just me, but also the specialists. And they were able to cooperate in their management. So I find that taking that time to hear what's going on with the family is very important in providing the best care. Their emotions were interfering with their ability to work with the team. That partnership has to be there for the patients to get the best care and the best outcome, and to be at least at peace with whatever the outcome is. If a patient comes in a wheelchair, they generally have an assistant with them, and you'll have to be making sure that the assistant has enough assistance in getting onto the exam table. And for some patients, that means that the staff will have to help get the patient on the table, exam table. And you'd have to take the time to make sure that they're comfortable on the exam table, that they're positioned properly. But there are other situations, for example, a patient who's hearing impaired. You have to make sure that you have a translator, a sign language interpreter, I should say, something that has to be arranged in advance, unless they're comfortable with a family member or friend doing the interpretation for them. So that's something that just requires planning. Patients who are blind or have a problem with sight, if those patients also need to have assistance in the exam room. There are people who come in with canes. Basically, you have to be careful about their safety from falling. They might trip over the scale, even the chair in a room where they're not familiar and they're not dressed, so that's a difficult situation for them. So attention has to be paid that they're comfortable in the room, that they have assistance in the room. It should be that whatever they need to get out of bed is within access. or if it isn't, then somebody should be immediately available to help them get out of bed. And there are something called fall precautions, people who are on precautions for falling that the staff is alerted to. And there's got to be some point at which the sensitive parts of the history cannot be obtained, where the patient has an opportunity to say, there's something I didn't tell you because my mother was in the room or my husband was in the room. And for example, I've had an abortion, or I had a herpes outbreak at one time, or I've had other partners besides my husband, for example. There's a wonderful technique, tool, I should say, for making sure that the patient is getting the most they can out of the visit, and that they are fully equipped to be a partner in their care. And I like the Ask Me 3 tool, where the patient is told or suggested that they would want to think about 3 aspects of their situation. The problem that they come in with, and they want to be able to ask the doctor, what is my problem? What is my diagnosis? What are the tests, the procedures that I have to go through? You know, what are the risks of the procedures? And then, what is the treatment? So questions about the problem, questions about the workup, the testing, and questions about the treatment. And what happens if I don't do the treatment? What happens if I do the treatment? So anytime a person is faced with a diagnosis or an emergency surgery, they want to ask me 3. And so I, from time to time, I'll tell patients about that and explain to them that with all the issues or the big issue that they bring up to me, this is something they want to keep in mind, so that I can make sure that they are aware of how to approach me, and that they feel free to approach me and ask me 3.